Today's session is on military population health, and I want to take a moment to introduce our presenters. Our first presenter today is Lieutenant Colonel Patricia Rohrbeck. She is a public health officer and research epidemiologist in the United States Air Force and is currently the director of the Military Population Health Directorate at the Naval Health Research Center. She is joined by Major Keyia Carlton. She is an Army research psychologist trained in health psychology with a focus in behavioral and community health service. They are joined by Dr. Rull. He is the principal investigator of the Millennium Cohort Study and a research epidemiologist in the Deployment Health Research Department of the Naval Health Research Center in San Diego, California. Our last presenter today is Dr. Rayna Matsuno. She's a career epidemiologist and oversees the women's health research portfolio for the Millennium Cohort Study. On the call from the VA today, we have Dr. Sally Haskell. She's the Deputy Chief Consultant with the Women's Healthcare Services in VA Central Office. And with that, we are going to go ahead and get things started. Dr. Rohrbeck, can I turn things over to you? And Patricia, you are still muted. You can use that button at the bottom right there.
Okay, I got it. Thank you, Heidi. Sorry about that. Good afternoon or good morning, depending on the time zone you're dialing in from. But my name is Lieutenant Colonel Patricia Rohrbeck, and I am the Director of Military Population Health at the Naval Health Research Center here in San Diego. Before I get started, I would like to thank CIDR for hosting us today, as well as Dr. Becky Yano and her team at the VA Women's Health Research Network for their support in coordinating this presentation with and for us. Thank you very much, Becky. As mentioned, I'm the Director of Military Population Health, and we are one of 3 directorates at the Naval Health Research Center. We also have the Operational Readiness and Health Directorates, and they are focused on researching physical and psychological stressors that impact our warfighters, as well as enhancing warfighter performance. And then we also have the Operational Infectious Disease Directorate, and they are focused on a variety of diagnostics, clinical trials, and disease surveillance. Currently, they're heavily involved in COVID-19 research. In military population health, we are focused on long-term studies that look at psychosocial issues, deployment, and career experiences throughout a military career, and how these affect the physical and mental health of service members and their families. And we do so by utilizing our internal and very unique longitudinal databases, as well as various other data available within DoD. Within military population health, we have 2 departments. One is deployment health research, and the other is health and behavioral services. We partner with many DoD organizations, but also with non-DoD entities like NIH, CDC, of course, the VA, and numerous universities. Especially when it comes to women's health research, we are hoping to find additional and more collaborators so we can expand this research area. And really appreciate the opportunity today to share the research we have done so far. I'm hoping I can turn it over now to Major Keyia Carlton, who had some technical issues. Are you on the phone, Keyia?
We are still trying to get Keyia on the call here. Okay.
I will just continue on, but Major Keyia Carlton is the department head of Deployment Health Research, and she has 4 major programs in her department. One is the Millennium Cohort Study, our largest study, and it's led by Dr. Rull. It includes all service members, and veterans, and data is collected via survey. Then we have the sister study, which is the Millennium Cohort Family Study, led by Dr. Valerie Stander. Also, all services focused on military spouses, and data is collected via surveys. Then we have the Birth and Infant Health Research Program led by Dr. Ava Conlin. It is also focused on all services, female service members and spouses, and data is collected via medical records. And then we have the Recruit Assessment Program, the RAT study, which is currently led by Dr. Keyia Carlton, and currently focused only on Marine Corps male Marines, and data is again collected via surveys. Looking at MilCo, the MilCo family, and the RAP study, those databases are about 20 years old and have all that data, and as well as the Birth and Infant Health Research Study. So I'm turning it over now to Dr. Rudy Rull.
Okay. All right. Thank you, Colonel Rohrbeck. I also like to again thank the WHRN and CIDR for this opportunity to share the Millennium Cohort Study with you. I'm just going to move down the slide. Again, here's our disclaimer. Being a government employee, and also to recognize the fact that the study itself is sponsored not only by the Department of Defense, but also by the Department of Veterans Affairs, and really helps facilitate the engagement with VA stakeholders as well. So I'll start by giving a brief overview of the study and then hand it off to Dr. Matsuno, who is our portfolio manager for women's health research, who will provide a profile of VA use among female veterans enrolled in the Millennium Cohort Study, as well as an overview of the women's health research portfolio. So the Millennium Cohort Study itself came out of the public concern in the 1990s regarding service member and veterans' health following the Gulf War and Vietnam conflicts. And this coalesced into numerous recommendations from the DoD, the Armed Forces Epidemiological Board, the VA, and the Institute of Medicine to develop a prospective longitudinal cohort study of service members. And this recommendation became a part of the 1999 NDAA, or National Defense Authorization Act, that directed the establishment of a study of post-deployment health, which became the Millennium Cohort Study, or MilCo for short. With a focus on deployments and other military experiences, the objective of the Millennium Cohort Study is to prospectively determine the impacts of these experiences on the long-term health of service members and veterans. And since the first panel enrolled in 2001, we have enrolled 3 other panels in 2004, 2007, and 2011, and have a total population of about 201,000 from these panels. This past September, we started enrolling our 5th panel of current service members, and as of this morning, almost 32,000 have completed their baseline survey. Our study participants complete an online or paper survey every 3 to 5 years, and this continues even after they leave military service. And in order to effectively capture the life course of service members, follow-up of participants is planned through 2068. The surveys are designed to assess participants' physical and mental health using standardized instruments and include questions on military experiences such as combat and deployment and other experiences including life stressors, alcohol and tobacco use, and sexual trauma. The survey data are also linked to multiple military and medical databases, including their military medical record and most recently their VA record. So while the core of the study is the survey data that's provided by our participants, this graphic illustrates the numerous enterprise databases of military healthcare utilization and diagnoses, deployment histories, immunizations, mortality, and other objective measures. And over the last 2 decades, analyses of survey data, links to these data sets have produced about 120 research articles published in scientific journals by our study team of epidemiologists, statisticians, and psychologists, and have often involved collaborations with not just the DoD, but the VA and academic institutions. This timeline illustrates the longitudinal and multiple panel design of the Millennium Cohort Study. From left to right are the waves of data collection with the enrollment panels from top to bottom. And as you can see in the current 2019 to 21 data collection, we are currently collecting the 6th wave of data from panel 1, participants who enrolled in 2001, as well as the first wave of data collection for panel 5 participants. And as I mentioned, the total population of MilCo from panels 1 to 4 stands at over 201,000 service members and veterans. With over 32,000 newly enrolled in panel 5, that number can now be corrected to around 233,000 now. And I hope that the number will be substantially higher when our enrollment period closes in June of 2021. And one of the methodological strengths of the cohort is the intentional oversampling of typically underrepresented groups in research studies, and this, has included women, Marines, and reserves, as well as, and we are also oversampling for married personnel to support enrollment into the Millennium Cohort family study of military spouses. And this slide provides a glimpse of the 61,794 servicewomen who make up about 31% of the first 4 panels of the cohort. This profiles their demographics and military service characteristics. About 36% are racial or ethnic minorities. Most female participants are from the enlisted pay grade and the active components. Our participating servicewomen largely come from the Army, with about 28,500 represented, followed by the Air Force, Navy, and Marine Corps, as well as approximately 1,000 Coast Guard members. About 55% have had at least one deployment, and almost 70% of the cohort is no longer in military service. We also know that about 0.75%, or approximately 460 of our female participants are deceased. So now I'd like to turn it over to Dr. Rayna Matsuno, who is our portfolio manager for women's health research, who will also provide a profile of VA use among female veterans enrolled in MilCo, as well as an overview of the women's health research portfolio. I appreciate your time and attention. Thank you.
Thank you, Dr. Rull. So as Dr. Rull mentioned, I'd just like to go over some characteristics of our women veteran population within the Millennium Cohort Study, and then I'll move on to discuss some of the past and current research efforts within the Millennium Cohort Study women population, and then pass that on to Dr. Haskell for a discussion of how we can move forward. So these slides were very kindly prepared by our collaborators and colleagues at the VHA. If you recall from Rudy's previous slide, there are about 61,794 women participants in our cohort, and of those, 45,307 are now veterans and have separated from military service as of March 2020. Of those 45,000, approximately 41,000, so 90%, have some VHA medical record. This doesn't necessarily mean that they have any encounter, but they do have some contact with the VHA. When we look at women veterans within the Millennium Cohort Study who do have encounters within the VHA, we can see that, so this is just kind of a distribution, the top 10 diagnoses for ICD-9 and ICD-10 codes separately. These are ICD codes that are in the primary position only. And you can see for both ICD-9 and ICD-10, so this corresponds to the different time periods before and after September 30th, 2015, post-traumatic stress disorder is at the very top there. This slide is presenting the number of outpatient encounters among women veterans in the Millennium Cohort Study. So on the left y-axis, we have the number of encounters, and those are also depicted by the yellow bars. And on the right y-axis, we have the number of female patients. So if, for example, we look at the year 2019, there were a little over 350,000 outpatient encounters among approximately 20,000 women veterans who had any encounter in that year. This graph is presenting similar information, but for inpatient discharges among women veterans. So on the left y-axis, we have the number of admissions, and on the right y-axis, we have the number of female patients. So again, I'll point you to 2019. So in 2019, there were approximately 1,100 inpatient admissions among 800, a little less than 800 women patients who had an admission that year. We think the decline in both the outpatient, or not really decline, but we see a little downslope in both the outpatient and inpatient discharges is that one reason is we had to stop this graph in October 2020, and so we didn't quite finish out through the entire year. This graph is showing the distribution of service-connected disability ratings among the women veterans in the Millennium Cohort Study. That category of none represents women who do have a record, who have some record in the VHA, but may not necessarily, they do not have a disability rating. And most of the audience probably knows that this differs from a disability rating of 0, in which a veteran does have a service-connected disability, but it wasn't severe enough to lead to a higher rating. So if you were to total up all of these categories, they would end up being that 41,500 or so number from my very first slide. The next thing I'd like to do is go over just very briefly some of the women-specific survey items that we do have. They've changed over the years, and we are currently preparing questions for the 2023 survey. And so we are working with closely with the BER team, members of the BER team, to add questions, maybe remove some questions, and add a little bit more detail to some of the information that we currently collect. So the topic areas for our women's survey questions include pregnancy and birth, menstrual periods, infertility and miscarriage, and contraception. So in terms of questions related to women's reproductive and gynecological health, some of the questions that we've asked in the past and on the current survey, the 2019 survey, include birth within the last 3 years, whether a participant is currently pregnant, do ask about gestational diabetes, number of live births, age at birth of the first child, and total number of months breastfeeding. And our current discussion is we're discussing whether to maybe include a little bit more detail on these live births, stillbirths, and ask more information on not just the most recent birth, but also previous births as well. Questions related to reproductive and gynecological health include asking a participant whether they've been bothered by menstrual cramps, asking about the regularity of their menstrual periods, and reasons for not having had at least one period in the last 12 months, as well as the age at first menstrual period. And again, there's some discussion. If you can look to the left, you see that the questions related to menstrual periods were not on our previous survey in 2014, and it's not on the current 2019 survey, but with, I think, a lot more attention to menstrual suppression, there's discussion within our team to add these questions back to the 2023 survey and ask a little bit more detail. Questions on our survey relating to, again, reproductive and gynecological health. Moving on, we ask about infertility, perceived fecundity, as well as questions about miscarriage. And again, these are questions that we are discussing adding back into our 2023 survey. In our current survey, the 2019 survey, we added questions on the use of oral contraceptives and other forms of contraception, and we do plan to ask these questions again on the 2023 survey. As Dr. Rull mentioned earlier in the presentation, and Lieutenant Colonel Rohrbeck also mentioned, we do draw not just from our survey data, but we also link with a number of other administrative databases. And in terms of medical encounter data for our active duty service members, we draw this primarily from the Military Health System Data Repository, or MDR. So the population that this would cover are active duty servicewomen while they are still in service. The database includes inpatient and outpatient ICD codes, ICD procedure codes, as well as CPT procedure codes. All of this covers the care that is covered by TRICARE, both at military treatment facilities as well as purchase care at private facilities. And we also have access to the DoD Birth and Infant Health Research Program, which falls under our directorate. They do draw just from the MDR data, and they focus on maternal, pregnancy, and infant outcomes and into early childhood for active duty service members as well as female beneficiaries. Probably one of the best news that we received in 2020 was that we now can link our survey, our cohort population with medical encounter data from the VHA. And this was really years and years of work that has now we've seen come to fruition. So this is very exciting. We already have mortality, outpatient, inpatient, and service-connected disability databases linked to our cohort. We do not yet have prescription drugs, vitals, or lab information, but that is something that we are working towards. Among all Millennium Cohort Study participants who have separated, over 80% have at least one medical encounter recorded in the VA. And I did do a quick check yesterday, and actually that number holds true for the women veteran population as well. So when we just look at the women veterans, 80% do have at least one medical encounter recorded in the VA. The next thing I'd like to do is just give an overview of the recent study findings from our study that have focused on service women. I'll give a little bit of detail for a select number of studies, and then give an overview, just give a quick overview of other studies that we have conducted before moving on to some of our current efforts. So the first study that I wanted to review and share with you are a study conducted by Ippolito et al. It was a study of risk factors for miscarriage and perceived impaired fecundity. This study included servicewomen enrolled in 2001 or 2004, so panel 1 or panel 2, and they were followed through either the 2004 or the 2007 survey. The primary exposures were deployment status, not deployed, deployed with combat, deployed without combat, deployed with combat, cumulative days deployed, and life stressors. And this was restricted to the panel 1 enrollees only. The primary outcomes were miscarriage and perceived impaired fecundity from the survey data, and then also looking at the medical records among the active duty study population only, also looking at these outcomes. For the miscarriage results, among the 3,400 servicewomen who reported a pregnancy during the follow-up period, 31% reported having had a miscarriage. And the key results in the association study was that there was no association between self-reported miscarriage and deployment with or without combat service. Similarly, there was no association with the length of deployment, and similar results were observed for miscarriages ascertained from medical records. Among panel 1 members, miscarriage did appear to be elevated among women reporting moderate high versus mild low stressors, life stressors, with an odds ratio of 1.67. For the impaired fecundity results, among 11,000 servicewomen, 11% reported impaired fecundity. In the association study, there was no association found between self-reported miscarriage and deployment with or without combat experience. Similarly, no association was found with length of deployment, and similar results were observed for infertility ascertained from medical records. And unlike the miscarriage results among panel 1 members, there was no association with life stressors. The second study that I would like to give share a little bit more detail is a study conducted by Wen et al. On maternal depression. The study population included servicewomen enrolled in 2001 or 2004, so our panel 1 and panel 2 service members who gave birth while they were in active duty service. And they were followed through 2004 or 2008. The primary exposure, again, was deployment status, so not deployed, deployed without combat, deployed with combat, which was assessed both before and after childbirth. And the primary outcome was maternal depression. And this was drawn from our survey, which has within it the PHQ instrument. And so it was based on simple scoring were greater than or equal to 10, indicated maternal depression. In a secondary analysis, among deployed active duty women, the researchers examined whether childbirth was associated with post-deployment depression. So among the 1,600 or so servicewomen who gave birth on active duty between baseline enrollment and their first follow-up survey, 11% screened positive for maternal depression at the follow-up survey. Combat deployment after childbirth was associated with maternal depression with an odds ratio of 2.01, but there was no association between deployment before childbirth and maternal depression. In the secondary analysis, among 3,400 active duty deployed women, about 20% experienced childbirth, and among the combat deployers, childbirth was not associated with depression. The risk of screening positive for depression appeared to be related to combat rather than child-related experiences. I do want to note that sexual trauma is a priority area for us, and it does fall within our behavioral health research portfolio. So I just wanted to share this infographic with you on some of the prior statistics that we have found within our cohort. Given this talk, I'll just focus on the women. So the left-hand side of this infographic, women who indicated or experiencing sexual assault, among those, 73% were more likely to resume unhealthy alcohol use. They were twice as likely to have difficulties in work or daily activities. Those who indicated experiencing sexual harassment were 47% more likely to have been demoted. And the work in this area is ongoing. So some other studies that we have conducted that have focused on servicewomen or women veterans include headache disorders, asthma, PTSD and autoimmune diseases, gender differences in PTSD development, HPV vaccination, initiation and adherence, cervical cancer screening, weight change, as well as obesity. Next, I'd like to discuss a little bit our current and future research directions. I feel like right now the bulk of our time is being devoted to this effort. It's the annual report to Congress on the health of servicewomen. So in fiscal year 2020, the National Defense Authorization Act, Section 748, mandated that we submit to Congress a report on findings of the Millennium Cohort Study relating to the gynecological and perinatal health of women members of the armed forces. And we submit reports annually through January 31st, 2022. So we have submitted the report for 2021, and it's currently circulating and being reviewed. So that is taking up quite a bit of our time. In the 2020 report, we summarized published findings focused on women participants in the Millennium Cohort Study. And in our 2021 report, we generated prevalence estimates for selected gynecologic, reproductive, and infant health outcomes. We also, majority of that used administrative data, but we are also using survey data to estimate the prevalence of some of those conditions. And this is in collaboration with our colleagues within BUR. And this year's report is a little bit more focused on menstrual suppression, and I believe we will probably focus a little bit more on that on next year's report as well. I did want to just give a brief discussion to the data linkage that we have with the VHA. As I mentioned, this was sort of years in the making, and it finally came to fruition. We're very excited about this. I wanted to note that Dr. Ed Boyko, who is at the VA in Seattle, this is really in large part due to his efforts, and he was with our Millennium Cohort team from the very beginning. So I have this 1999 there. He's really he was there at the inception and continues to be just a key member in our efforts. As I mentioned earlier, we currently have inpatient and outpatient encounters linked to our cohort, as well as service-connected disability ratings. I do want to note that currently veteran-focused research on the MAJ data has to be conducted at the Naval Health Research Center. We do have several veteran-focused research projects underway. We submitted last year 2 grant applications by VA investigators and our team to study melanoma and Parkinson's disease. Since preparing these slides, we did receive word that the Parkinson's disease study was funded, and that was funded through the Michael J. Fox Foundation. So we're just working on some administrative details, and that study will start shortly. Approval has been granted for transfer of Millennium Cohort data to the VA Cooperative Studies Program 505, and plans are underway to make these data available for analysis within the VA firewall. So the data will reside on Vinci. The data resource guide and dictionary are currently being developed. Information and instructions for access are now available and can be found on the InvestedR website and will be updated as needed. As I mentioned earlier, when going over the women's health survey items, we are currently collecting the new survey items on the 2019 survey, and items for the 2023 survey are in development. This includes both the women's health module as well as the veteran-specific module. And very briefly, the current projects that we have ongoing that are specific to service women include looking at sexual health, mortality, and as well as musculoskeletal conditions and injuries. And this is a DHA Health Services Research Award, and the PI for that study is Lieutenant Colonel Rohrbeck. In terms of our future research directions, some potential future projects include looking at unplanned pregnancies and suicide risk, pregnancy complications and CVD risk, mental and physical health among women in combat occupations. And I was not able to attend, but in January of 2020, we met with Dr. Becky Yano's group at a VA summit, and some of the topics that were mentioned at this summit for future research included looking at the link between reproductive and mental health, looking at hysterectomies and the rate of hysterectomies and examining whether there are differences by race, trauma-sensitive care, contraceptive use, and cardiovascular conditions during pregnancy and the long-term health outcomes. And much of this would be in coordination with BRR, the DHA Women and Infants Clinical Community, and the VA Women's Health Research Network. So next, I'd like to pass this on to Dr. Sally Haskell, who will lead a discussion on future directions that we might be able to take, and I will pass the presentation on to her. Thank you very much.
See, I think you need to transfer that little ball to me. There you go.
There we go.
Okay, great.
Oh,
Thank
there.
you.
Okay.
Okay. Let's see if I can advance the slides now. Here we go. Okay. So hi, everyone. And thank you so much for having me here today. I did want to thank Lieutenant Colonel Rohrbeck, Dr. Rull, Dr. Matsuno, and also wanted to thank again Dr. Becky Yano and the Women's Health Research Network, who really have made this collaboration and this presentation possible. I wanted to start off just talking about the alignment between women's health services goals and the goals of military population health. So as I was looking at this, I was really struck by the goal of the military population health in terms of providing an increased understanding of the long-term impact of military health, and how that's really been a goal, kind of an overarching goal of women's health services for a long time. It sort of falls under some of our other goals. You can see our main goals here are that women veterans receive high-quality patient-driven health care, that they receive care that's seamless and holistic and collaboratively delivered, that culture is transformed, and that VA is a national leader in women's health. I'm going to go on to the next slide, and these are some of our sub-goals, but you can really see some of this very same language. We want to identify the needs of women veterans as a result of military service, to include their impacts on overall health, impacts on reproductive health, potential impacts on intergenerational health. And then, just thinking about this project and this collaboration between the Millennium Cohort and the VA, I think we have a mutual goal of understanding the impact of military service on women's health. And we have to think of this as just an unprecedented opportunity for VA researchers. What we really need to be able to do in VA is to really understand what our treatment targets are. We need to be able to identify conditions that are common in women veterans. We need to be able to identify risks that are present early on, and then be able to develop those treatment targets, to intervene early, and then to use that evidence as an evidence base to develop our policies and to develop programs that target gender-specific needs and really improve the long-term health outcomes of our women veterans. So just thinking again about these incredible research opportunities, as was mentioned in the previous slides, I think that 80% of the women veterans in the Millennium Cohort actually have a medical encounter in VA. So it really means that, we can link all of that very rich survey data to our electronic health record. It also means that there are 20% who don't have a medical encounter in VA. So this is actually, kind of an opportunity for us to look at data on VA users compared to non-users, which is something that we're not often able to do. And then, as many of you on the call know, we have loads of research on women veterans, but some of it has been done on much smaller scale surveys and projects. And so this data really gives us an opportunity to go back and validate some of the previous work that we've done with much larger scale data. Again, it gives us an opportunity to look at gender differences in outcomes with the background of really, having more information about risks and exposures, and then how gender differences may result from those. And another area to think about is places in the VA where our data has really been lacking. And so thinking about something like maternal and infant outcomes where we've really had a hard time capturing data in the VA. And so through the Millennium Cohort Survey, we will have very rich information to look at some of those challenging areas. And let me see. So again, thinking about identifying conditions, identifying risks and exposures, and then tracking those into VA care. This could enable us to do things like developing predictive algorithms. So we could potentially be able to determine among veterans who get a certain exposure or service members who get a certain exposure, we could sort of, track them into the future and look to see what determines certain outcomes, and then begin to develop some predictive algorithms that might be very helpful in initiating early treatment. Again, I mentioned enriching our understanding of some of our previous work by contrasting the Millennium Cohort data with previous VA research. And then I think about areas that are really important to focus on. I noticed that in the discussion that was held with VA researchers previously, a lot of reproductive health topics were mentioned. And of course, those are extremely important as, women-specific topics, but I do think we also have to think about gender differences in non-gender specific conditions like cardiovascular health, musculoskeletal health, and mental health. And then, of course, the maternal and reproductive health as well. So those are some of the many, many areas that I think we can use this data to continue our investigations. So I think that's the end of my comments, and I will just be happy to turn it over, and we can open up the floor for questions and discussion.
Major Carlton was able to join us on the call. I'm not sure if we want to go back to any of her slides and revisit any of that.
Should I move the little ball to Major Carlton?
I can slide that over to her.
Oh, okay.
Hello, I'm not exactly sure what was presented, and I apologize. We tried our best to make sure everything was straight on Friday. The main goal I had was kind of to plug the rest of the studies that we have in our department because they're all somewhat interrelated. But basically, I just wanted to communicate that, you know, we have a unique opportunity to go ahead and do research with the VA. I guess the slides pretty much said it all. The only other thing I wanted to point out with the RAP survey is currently we're about to move on to include female participants there. We're about to get some females actually at NCRD San Diego next month, and we're also expanding the survey to Paris Island. And I'm actually hoping to get the other services involved. As you could probably tell, that was the only survey that we had there that that did not include the entire DOD. And so, so hopefully we can get that expanded. But, you know, that survey is kind of like a baseline health survey or like the initial piece of a longitudinal health record that we can use. And that would work, you know, across the DOD and also with veterans. So I'm hoping to keep you posted on that. And I just wanted to say thank you for this opportunity. And hopefully we can get maybe an additional cyber seminar scheduled in the future. So thank you so much. And I apologize that I wasn't able to get on earlier today.
It was definitely not your fault. We think they did some sort of update over the weekend, and these things definitely happen here. So, but if you guys are at the point, we can move on to questions. If there's no argument, and one quick comment that I'm going to make for the audience. I know a lot of people are looking for a copy of these slides. We received approval to distribute really late in the process, just a few minutes before the session started. So we do not have them posted yet. I will be getting those posted as quickly as possible. When you receive the archive notice in a day or two, you will be able to download the handouts from that screen. So keep an eye out. As soon as we send out that archive notice, you will be able to download the handouts from there. And if all of our presenters are ready, we can start on the questions.
Sounds good to me.
Perfect. Okay. So the first question that we received here, are there questions about abortion or access to abortion?
We don't currently have questions on our survey. It is a sensitive area, so we're not sure we would even be able to have questions like that on our survey, unfortunately. I don't know if anyone else wants to chime in about that, but it was a topic area that we had considered as we're developing the 2023 Women's Survey module. But no, we do not currently ask questions about abortion.
Yeah,
okay.
I know that's something that we are planning to try to include also on the RAP survey. So we are attempting to get those questions included, but you know, we have to get those approved, like Rayna discussed.
Okay, great. Thank you. Okay, the next question here. How might someone interested in collaborating or using MilCo data get involved?
Hi, this is Rudy. I can take that question. We work very closely with CSP 505, the Cooperative Studies Program 505, that's chaired by Dr. Ed Boyko, and they are essentially the Millennium Cohort Study on the VA side, and so requests for interest in collaboration can be facilitated. There is a process for initiating these, and these involve, there's a research request form that's been developed by his program manager, Amber Banerjee, and that sets up, a process for describing the idea and seeing to what extent the MilCo survey data and linked VA data can support that idea, and then it really starts the process for getting a proposal approval that is reviewed both by the Cooperative Study Program as well as the MilCo Scientific Review Committee here at NHRC.
Great, thank you. The next question here, are you, MilCo team, able to access any of the Million Vet data that is linked to your MilCo data? We are particularly interested in the genomics data that the VA has collected, and it appears one way from the slides.
Currently, it is one way. We do work, for those who aren't as familiar, we are working with the Millennium Veteran Program. There has been a co-enrollment effort as part of the Precision Medicine Initiative to enroll current MilCo participants into MVP. Currently, we are at about 9,200 MilCo participants are in MVP. And actually last week I was on a call with Dr. Boyko and the MVP team to talk about potential research ideas for that population of MilCo MVP participants. Currently, the genomics and the survey data for MVP, it really is, it essentially is entirely on the VA side. I believe the informed consent does not cover sharing of that data outside of the VA. But we are currently strategizing on ways to link MilCo and MVP data. But right now, I think that will essentially be done on the VA side.
Great, thank you. Okay, the next question here. Have you gathered data on birth outcomes, i.e. cesarean rates?
We don't assess that on our survey. Rudy, you might know if this is something that the BRR team has looked at using administrative data, but this would definitely fall under a lot of their work.
Yeah, that's a good question. I'm not sure to what extent BRR does track that outcome, and I don't think that we've looked into looking at that within the records, medical records, on the DoD side yet.
That's something I'd be happy to pass on to the BRR team.
Okay, great. Thank you. The next question here. Has any study been done, or is there data to evaluate the link between VA engagement earlier in the servicewomen's journey that promotes increased enrollment in VA's benefits and services? There is still a large number of women who do not enroll.
Hi, this is Rudy. Yeah, I'm thinking about that question. I don't know, Rayna, if you had something to suggest. Yeah, because right now it's, I think that really opens up a huge area of, where veteran women seek care elsewhere, and really, thinking about, and so we do try to capture some utilization within our surveys, but in terms of, but I think it's a totally different issue with getting into records from other sources.
Great, thank you. Sorry, I'm going through the questions. We're continuing to get questions on the slides. The slides are not posted yet, but everyone will be able to download them from the archive notice when that is sent out. Okay, the next question here. Have you done any studies on vaccines and birth outcomes?
That's actually a very rich area that the Birth and Infant Health Research Program does. They have done extensive studies on the Tdap and birth outcomes. I believe they've done other vaccines and work with companies, for that develop vaccines to do some of the tracking of outcomes within the population. MilCo specifically has not done work related to that, but I know that is a rich area of work for the BRRR program.
Yes, I'm hoping if we get the opportunity to have another cyber seminar that focuses on BRRR's work with women's health, but they're focusing on a lot of medical records rather than surveys. So that's something that we might be able to potentially plan in the future.
Great, thank you. Okay, the next question. Any thought on including menopause-related questions, especially as military women veterans are aging?
That is actually, I'm glad that was brought up because that is something that has been in discussion with our group as we develop the 2023 survey items. Thank you.
Great. Okay, the next question here. Is there any effort to track future perinatal data on female veterans who deliver in the civilian community, like birth defects? Those may not be readily apparent if only AD women are surveyed using DoD AD database information.
Heidi, could you repeat that question? I'm sorry.
I feel really bad, everyone. I'm not a subject expert, so I do my best when you send in abbreviations, but I know I butcher a lot of things. But I'll try this again here. Is there any effort to track future perinatal data on female veterans who deliver in the civilian community, like birth defects? Those may not be readily apparent if only AD women are surveyed using DoD AD database information.
Okay, yeah, so I think this again would be very difficult in terms of getting linkages to other health administrative databases, unfortunately. So that would be something definitely important and of interest, but might be limited in that way in terms of data access.
Okay, great. Thank you. It is 1:59. I have one question that just showed up on my screen that I'm going to ask, and then we're going to close out today's session. But the question here, how can we access copies of the annual reports to Congress?
I'm happy to dig up that link. Those reports are shared on the Military Health System MHS website. I can send the link to Heidi, for when the slides are available. And so the first of three reports, or first of three annual reports, is already on that website. We are currently working on the second one with DoD Health Affairs, and then there will be one more in the following year.
Fantastic, thank you. We do definitely have several pending questions left here. I will get those sent over to the presenters, and we will do our best to get a response out to the audience. But it is the top of the hour here, so we're going to wrap things up. I just want to check in with our presenters to see if anyone has any closing remarks you'd like to make before we close the session today.
Yeah, this is Lieutenant Col Rohrbeck. Again, I wanted to thank CIDR and Becky Yano and the VA Women's Health Research Network. This was a great opportunity for us, and we greatly appreciate that we were able to present our research. Thank you so much.
Yeah, I want to second that. I really appreciate the opportunity. Thank you.
And this is Sally Haskell. Thanks for the collaboration.
And I want to thank all of our presenters for taking the time to put your information together and to prepare and present today. We really do appreciate all of your time. For the audience, when I close the meeting out, you will be prompted with a feedback form. We would appreciate if you would take a few moments to fill that out. We really do appreciate all of your feedback. Thank you, everyone, for joining us today, and we look forward to seeing you at a future HSR&D Cyber Seminar. Thank you, everyone.